Good evening, everyone. We're going to get started. Thank you all for being here. I'd like to begin by acknowledging that we are gathered on the unceded traditional territory of the Algonquin and Anishinaabe people. This land has long sustained Indigenous communities who continue to care for it today. We also recognize the enduring contributions of First Nations, Inuit, and Métis people to this region. Unceded reminds us that this land was never surrendered or legally transferred to the Crown or to Canada. As we reflect on this, we acknowledge the deep impacts of colonization and the legacy of residential schools. In the spirit of reconciliation, I commit to advancing Indigenous health equity through meaningful partnerships and systemic change. This means prioritizing Indigenous-led initiatives in public health planning, embedding trauma-informed and culturally safe practices across our services, supporting Indigenous data sovereignty, and creating opportunities for youth leadership and intergenerational knowledge sharing. I invite each of you to consider how your work can contribute to these goals and how we can collectively uphold Indigenous rights, knowledge, and self-determination in our public health systems. May I have the roll call, please, Madam Board Secretary?
Member Bauer?
Present.
Member Carr?
Here.
Member Chung? Member Dudas?
Present.
Member Gower?
Here.
Member King?
Here.
Member Ejiofor?
Present.
Member Bradley?
Here.
Member Grutenwald?
Here.
Vice Chair DiGiovanni?
Present.
And Chair Kitts?
Here.
We have quorum, Madam Chair.
Thank you very much. We have no regrets this evening. Are there any declarations of interest? Seeing none. Confirmation of minutes of the meeting of September 15th, 2025. Are these confirmed? Thank you. We have one communication item that has been received and held on file with the Board of Health Secretary. Motion to introduce reports. Member Chung, please.
Board of Health verbal report, medical officer of health verbal report, and the report's titled Renewal of Ottawa Public Health's Approach to Supporting Older Adults in Ottawa to Age Well, Risk Management at Ottawa Public Health, and Attendance at the Association of Local Public Health Agencies. Fall symposium be received and considered. And be it further resolved that the rules of procedure be suspended to receive and table the report titled 2026 Draft Operating Budget for the Ottawa Board of Health.
Thank you very much. Is this carried?
Here.
Thank you. So we'll go through the consent agenda. Item 7.1, Chair of the Board of Health verbal report will be held. Item 7.2, Medical Officer of Health verbal report will also be held. Item 7.3, 2026 Draft Operating Budget for the Ottawa Board of Health, we will hold for a presentation. Item 7.4, Renewal of Ottawa Public Health's Approach to Supporting Older Adults in Ottawa to Age Well, we will hold for a presentation and delegations. Item 7.5, Risk Management at Ottawa Public Health, we are going to hold for a comment from the Medical Officer of Health. And any questions? Item 7.6, Attendance at the Association of Local Public Health Agencies Alpha Fall Symposium. Is this item carried?
Here.
Thank you. And item 8.1 is an item previously distributed, Monitoring Food Affordability in Ottawa 2025 Nutritious Food Basket. Is this item received? Great, thank you. So we'll return to item 7.1, which is my verbal report. So Kwe, Anin, Shekan, Tanshi, Unukut, and good evening, everyone. Thank you all for being here this evening. Tonight, we will hear from Ottawa Public Health staff as we table the 2026 Draft Operating Budget for the Board of Health. I would like to take this opportunity to note that this budget has once again been developed under a provincial funding formula that no longer reflects the realities or needs of our public health unit. We recognize and appreciate the ministry's commitment to reviewing the funding model, and we look forward to that process moving ahead. As I have emphasized before to this board, to City Council, and to the Minister of Health, I continue to call on the ministry to ensure that this review results in a fair and equitable approach, one that truly meets the needs of Ottawa and provides sustainable funding for our public health services. That means funding 75% of Ottawa Public Health's cost-shared budget required to deliver services mandated by the Ontario Public Health Standards, providing an annual increase to base funding that reflects the average 3 to 4% annual growth in expenditures needed to sustain current service levels, and investing in new capacity to meet the growing and increasingly complex health needs of our expanding and diverse population, particularly among newcomers. J'ai hâte de travailler ensemble et d'avoir les discussions qui nous tiendront dans les prochains jours et semaines au sujet de notre budget. Finally, I want to extend my sincere thanks to the staff of Ottawa Public Health for their dedication, professionalism, and unwavering commitment to serving residents with the resources available to them. In accordance with our procedural bylaw and our past practice, it is important to note that tonight's meeting is not intended for debate or amendment of the budget. Rather, it is an opportunity to introduce the budget and begin the public consultation process. Board members may ask clarifying questions, but motions to amend or adopt the budget are not permitted at this stage. The budget will return to the board in December, at which time we will engage in full discussion and deliberation, including the opportunity to propose amendments and vote on its adoption. This process ensures transparency, encourages public input, and allows for thoughtful consideration of the resources needed to support public health in our community. I'd like to take a moment this evening to acknowledge a recent motion that passed unanimously at City Council last month, brought forward by Councillor Carr and seconded by myself, which calls for a comprehensive strategy to address the root causes of food insecurity within the City of Ottawa. Au nom du Conseil de santé d'Ottawa, je tiens à appuyer cet appel et à réaffirmer notre reconnaissance de l'insécurité alimentaire comme un enjeu critique dans la santé publique. We know that access to nutritious, culturally appropriate food is essential to health, and that food insecurity is deeply connected to income, housing, and systemic inequities. As a board, we remain committed to supporting initiatives that align with the city's poverty reduction strategy. We will continue to advocate for income security, affordable housing, and meaningful access to food for all residents. I also want to take a moment to highlight Ottawa Public Health support for the 2025 position statement on active outdoor play developed by Outdoor Play Canada. This evidence-based statement reinforces the importance of outdoor play for health and well-being across the lifespan, and it aligns closely with our strategic goals to create conditions that help people live well and thrive. OPH staff were actively involved in the launch of the statement at the Breath of Fresh Air Outdoor Play Summit in September, and their participation reflects our ongoing commitment to promoting healthy environments for children, youth, and families. With that in mind, I'd like to call for a motion this evening for the board's formal endorsement of the statement as a way to further demonstrate our support for outdoor play as a vital part of public health. And I believe, Member Chung, you have the motion if you are able to read it in.
Whereas research shows regular physical activity helps reduce the impact of or prevent many chronic diseases, helps prevent premature death, and helps improve quality of life and physical functioning. And whereas access to active play in nature and outdoors with its risks is essential for healthy child development, including physical and mental well-being. And whereas promoting physical activity is part of the Ontario Public Health Standards, OPHS, and aligns with key elements of Ottawa Public Health's OPH 2023 to 2027 strategic plan, the City of Ottawa official plan, and the City of Ottawa Transportation Master Plan. And whereas Outdoor Play Canada, an Ottawa-based national not-for-profit organization that brings together advocates, practitioners, researchers, and partner organizations to promote, protect, and preserve access to play in nature and the outdoors for all people living in Canada, launched the evidence-based 2025 position statement on active outdoor play, AOP 10, on September 25th, 2025. And whereas the AOP 10 calls for systemic change and includes calls to action for individuals, communities, and different sectors, which aim to make active outdoor play a fundamental right and sustainable part of societies. And whereas OPH staff were present at the Canadian Centre for Outdoor Play for the launch of the AOP 10 to show support and make a statement regarding the health benefits of active outdoor play. And as a formal endorsement by the Board of Health for the City of Ottawa Health Unit can enhance the social norm that active outdoor play is beneficial for health and well-being and can be used by Ottawa Public Health staff as a framework for supporting physical activity policies, training, and infrastructure initiatives with other City of Ottawa departments and external partners. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit formally endorse the Outdoor Play Canada 2025 position statement on active outdoor play and express its strong support for Ottawa Public Health to work with partners and support changes that advance the individual, population, and community health benefits of active outdoor play. And be it further resolved that the Board of Health for the City of Ottawa Health Unit requests that its members collectively and individually, and with support from Ottawa Public Health employees, serve as public health champions by advocating for active outdoor play in accordance with this motion at every opportunity, including at other boards, at working groups, at standing committees, at subcommittees, and at City Council.
Thank you very much, Member Chung. Is that carried? Great. Thank you very much, everyone. Finally, to conclude my verbal report, I also wanted to let you know that last month, Dr. Arneson started a regular biweekly media segment on Bell Media platforms, CFRA and CTV News. The goal of this collaboration is to provide timely, expert-driven public health insights to Ottawa audiences through trusted broadcast platforms. This proactive initiative, which is supported through preparation and planning by the Health Information and Public Engagement team, strengthens health literacy, counters misinformation, and reinforces evidence-based messaging, especially for younger adults and families. So tune in and share where possible. That concludes my verbal report. Cela conclut mon rapport verbal. I would be happy to take any questions. Seeing none, is this received? Great, thank you. Over to you, Dr. Arneson.
Thank you. Good evening. Kwe Unusikut, Tanshi Ani, bonjour. Tonight, I will be providing brief updates on OPH's Clarence Street Supervised Consumption Service, some important developments on measles and wastewater surveillance for respiratory viruses, the Ontario Public Health Standards, and a preview of 2026 priorities and budget planning as we table the budget this evening. As many of you are aware, Ottawa Public Health Supervised Consumption Service and drug checking services at 179 Clarence Street stopped operating on September 30th. This closure followed the expiry of the site's federal exemption under Health Canada's Controlled Drugs and Substances Act. Under new provincial legislation, OPH was required to obtain permission from the Ontario Minister of Health before applying for renewal. Despite our efforts and ongoing communication with the ministry, the permission was not granted. This closure is disappointing, and we are concerned about the impact it will have on residents who rely on these important services. Since opening in 2017, staff at the Supervised Consumption Service have seen tens of thousands of visits, but numbers alone do not capture the importance of this work. Derrière ces chiffres, il y a de vraies personnes, une vraie confiance établie et de vraies connexions créées avec des gens qui ont souvent enduré les obstacles et la stigmatisation liée à la consommation de substances. Ces liens sont importants, ils contribuent à ce que les gens obtiennent le soutien en matière de rétablissement, de traitement et de soins de santé dont ils ont besoin et qu'ils méritent. While supervised consumption and on-site drug checking services have ended, I want to reassure the community that other services will continue at our Clarence Street location. This includes supply distribution, naloxone training, sexually transmitted and bloodborne infection testing and treatment, and system navigation. Our mobile harm reduction van also remains in operation 7 days a week from 5 p.m. to 11:30 p.m. OPH is also now offering outreach during the day in collaboration with city and community partners in identified areas of need. I want to take a moment to thank OPH's employees for their ability to pivot quickly to respond to the needs of the community and for their care and compassion. Their dedication has been unwavering, and I am deeply grateful for their work. On to the end of the measles outbreak in Ontario. I'm pleased to confirm that the Chief Medical Officer of Health, Dr. Kieran Moore, has officially declared the measles outbreak in Ontario over. This follows 46 consecutive days without a new case that is linked to the provincial outbreak. Unfortunately, in the days following the end of the Ontario outbreak, Ottawa did see a number of people diagnosed with measles, likely connected to travel outside the province. Our OPH team is diligently following standard case and contact management procedures and collaborating with community and health partners to support those affected and prevent further cases. At this time, the risk to the public remains low. This is a reminder that Ottawa is at risk of importations of measles cases, and we need to maintain high levels of vaccination against measles to prevent local outbreaks. Je tiens à remercier les résidents d'Ottawa pour leur efforts afin de rester à jour avec leur vaccin. S'ils ne sont pas certains de leur statut de vaccination contre la rougeole, ils peuvent consulter notre site web à santépubliqueottawa.ca /rougeole ou parler avec leur fournisseur de soins primaires. So if people aren't certain about their vaccination status, they can check ottawapublichealth.ca/measles. I'd also like to provide an exciting update on wastewater surveillance, which has been the subject of ongoing interest from city councillors, board members, and Ottawa residents. As part of our commitment to innovation, proactive public health leadership, and keeping the public informed of scientific data, Ottawa Public Health is continuing its partnership with the University of Ottawa to ensure ongoing monitoring of COVID-19, flu, and RSV in local wastewater through September 2026. Local wastewater testing for infectious diseases has proven to be a valid, near real-time, and reliable method of public health surveillance. This agreement allows OPH to continue to publish data from wastewater surveillance weekly on the OPH Respiratory and Enteric Surveillance Dashboard to keep Ottawa residents informed. I encourage residents to continue to use the dashboard to monitor the risks of respiratory illness in the community. À l'approche de l'hiver, il est important de se rappeler de nos couches de protection comme la vaccination, se laver les mains, couvrir sa bouche et son nez lorsqu'on tousse ou éternue pour aider à prévenir la propagation des maladies respiratoires. Speaking of vaccines, they are now available this season for COVID-19, flu, and RSV. As of October 27th, the COVID-19 and flu vaccines are available for everyone aged 6 months and older who live, work, or go to school in Ontario. All details about these vaccines are available on our website at ottawapublichealth.ca/respvirus. As we look ahead to 2026, we are preparing to implement the revised Ontario Public Health Standards, which were recently released as working drafts by the Ministry of Health. These standards set the minimum expectations for public health programs and services across the province and will guide our work in the years to come. The revised OPHS include foundational and program standards, along with 27 protocols, some of which have now been shared. While some, including the substance use prevention standard, are still pending, we are actively engaging with the ministry to get clarity on when the full set of documents will be released, and we are preparing for implementation by January 2nd, 2026. We are in the early stages of reviewing the revised standards to understand the scope and nature of the revisions. Dans le cadre du processus annuel de planification opérationnelle, les équipes détermineront des stratégies pour mettre en œuvre les normes révisées. Un rapport plus détaillé au sujet de ces normes sera présenté lors d'une prochaine réunion du conseil de santé. And of course, tonight we are also tabling the 2026 draft operating budget for OPH. This is an important opportunity to begin reviewing the proposed investments that will support our work in the coming year. As we look ahead to 2026 through operational planning and budget review, I want to acknowledge the dedication of employees, partners, and this board over the past year. The work we do together is not easy, but it is essential. The challenges we face, ranging from substance use to climate change, from food insecurity to infectious diseases, requires us to be nimble, compassionate, and grounded in evidence. I look forward to continuing this work with you in the year ahead. And that concludes my verbal report, and I would be happy to take any questions on them. Thanks.
Member Bauer.
Thank you, Chair, and thank you, Dr. Arneson, for your report. I'd like to touch upon the closure of the safe consumption site on Clarence. And I thank you, first of all, for your very timely letter to the Mayor, Council, and the Board on October 1st to provide us with an update. It seems like the ministry did not reply to our request for an exemption. So I'm wondering if there's any pathway forward with them that is envisioned to solicit a response, or are we viewing it as a definitive closure at this point in time? And secondly, I was wondering if you had any insight from your team in terms of the impact on the community around this closure site, around and with our partners in Ottawa Inner City Health and Sandy Hill Community Health Center in terms of picking up extra clients or overload on their services.
Thanks very much for the questions. So we did receive just at the end of last week some response back from the province to the letter indicating that they would not be processing the request for us to apply for renewal, and encouraged us to continue our work with partners around the heart hubs in Ottawa, as outlined in their response to the overdose crisis. And from that letter, I feel that there was finality on this specific issue of the supervised consumption services at Clarence Street. In terms of what we're doing in response to the closure, we've been shifting to outreach in terms of meeting people where they're at around the location, and a lot of this work happens through partnership work, as you mentioned, Ottawa Inner City Health, and some of the community centers who run continued harm reduction services, including the Heart Hub at Somerset West Community Health Center, have been really important partners in our work. And so we've been speaking with them regularly before the ending of these services, and continuing to around what we can do to support people in the community through naloxone use and other harm reduction services. And it's important to know that we're continuing many of these services, as I mentioned, at Clarence Street, and looking to help people navigate to access services in the surrounding areas. In terms of monitoring, that's a really important part of what we do as public health. So I would say our big roles are on this issue of mental health and substance use in the context of the opioid overdose crisis are the surveillance pieces and monitoring what's going on. We have the Ottawa's dashboard for mental health and substance use health that people can use and look at to monitor the situation. I think it's important not to attribute short-term changes to any one thing that's happened in the community. It's a complex situation, and we're continuing to get feedback about what we're seeing on the ground. But there are a number of things that have influenced the number of overdoses in Ottawa, even recently, especially the toxicity of the drugs that people are using. And so our interventions, as important as they are, don't always translate into immediately what we see, but we're monitoring the long-term trends, and we're continuing to look at where we can work with partners to support people in need. And the heart hubs are one area where the partners at Pinecrest Queensway Community Health Center and at Somerset West have made some advancements recently, and we're talking to them regularly about how we can work together to help them achieve their goals around establishing those heart hubs.
Thank you very much, Member Bauer. I'm not seeing any other hands. So is this item received? Thank you, everyone. Item 7.3, 2026, draft operating budget for the Ottawa Board of Health. So we'll invite staff to come up for a presentation. So members will find a copy of the report in their email when those of us in person have received a hard copy as well. And over to you, Kirbria, for the presentation.
Honorable Chair, board members, and my dearest OPH team, members of the community, Shubho Shandha, Bonsoir, Masal Khair, good evening. There's 4 ways to say hello, and one way to remind us that public health speaks many languages, sometimes all at once. This evening, I'm honored to present Ottawa Public Health's 2026 operating budget, joined by my colleague, Christopher MacDonald. Tonight, I will walk you through the key elements of our 2026 budget, the fiscal realities that we are facing, the steps that we have taken to manage them, and the broader challenges that continue to shape public health funding in Ottawa. Let's start, as all good budget stories do, with a broader economic context and the operating cost pressures shaping next year's plan. This slide sets the stage for Ottawa Public Health's 2026 budget. Like many departments across the city, OPH continues to operate in a challenging fiscal environment. Ottawa's economy is slowing. Unemployment rate is on the rise, and both household spending and business confidence have softened. These trends affect the entire municipal system, from tax revenues to service demands, and they frame the context in which we build next year's budget. While the cost of living and doing business continues to rise, provincial funding has remained largely flat, creating persistent pressure on our operating budget. For 2026, OPH is managing about $4 million in budget pressure. This includes $3.2 million in annual compensation and benefit increase, $330,000 for one-time technology investment, $440,000 for the reversal of one-time city funding that we received for 2025. These pressures reflect the structural funding imbalance that we have faced for several years, where operating costs rise faster than available funding. Even maintaining our current level of service now requires nearly $4 million in additional resources next year. This challenge is not new, but it has become more pronounced as we continue to bridge gap with temporary solutions. Given these pressures, let's talk about how we managed to balance this equation without cutting essential services. Public health, as Dr. David Butler Jones once said, is an act of imagination, finding solutions before problems arrive. That really captures how we approached next year's budget. To stay balanced, we took a measured and responsible approach, combining gapping, efficiencies, prudent use of reserves, and funding from partners, the art of doing more with the same. We increased staff gapping from 3.9 to 4.5%, saving about $537,000. We identified $365,000 in efficiencies by reducing non-compensation costs through a detailed service review and service optimization. We secured $370,000 funding from partners that offsets our operating cost in immunization. And we planned $605,000 withdrawal from our IT reserve to support electronic medical record expansion. These measures maintain a balanced budget for 2026 without compromising service, programs, or people. Let's zoom out for a moment and look at the big picture, where our dollars are going and what they support. For 2026, OPH's gross expenditure is $88.5 million. This is an increase of about $2.4 million from last year. Most of this expenditure, nearly $73 million, supports our cost-shared core programs, the program that is considered as the backbone of public health in Ottawa. This category increased by $2.5 million, reflecting cost of living adjustments, benefits, and ongoing system modernization. Other major programs remain steady. For example, Ontario Seniors Dental Care Program, $3.3 million. Healthy Babies, Healthy Children Program, $5.5 million. Miscellaneous Program, $1.8 million. And city-funded programs, $4.9 million. This budget protects the essentials: our workforce, frontline capacity, and critical programs, while managing pressures responsibly. Now that we have seen where the dollars go, let's look at how we bring them in, starting with recoveries and allocations. For 2026, OPH anticipates about $2.7 million in recoveries and allocations. These are forms of revenue, but they are tracked separately because they represent cost recoveries and interdepartmental transfers, not direct program funding. Most of this comes from dental and denture charges. It's about $2.1 million, which are reimbursement that we receive against invoices submitted to the province through CSSD. Next to dental charges is the $510,000 insolvent funding that supports our needle retrieval program. This funding originates from the Ministry of Solicitor General, flows through another city department, and then transfers to OPH, which is why it's accounted under recoveries rather than revenues. While modest in scale, these recoveries play an important role in offsetting costs and reducing the city's funding requirement. We have covered internal recoveries. Now let's turn our attention to the broader revenue sources that sustain our operations. For 2026, OPH projects $53.7 million in revenue from multiple sources. The Ministry of Health remains our primary funder, contributing $45.3 million for cost-shared and other provincially mandated programs. We also receive $5.5 million from the Ministry of Children, Community and Social Services for the Healthy Babies and Healthy Children program. Beyond provincial support, we anticipate $1.9 million in fees and service revenues. We are also planning to withdraw $605,000 in IT reserve for electronic medical record expansion. We are also anticipating $370,000 in partner transfers. Together, these revenues form the foundation of our operation. But with limited provincial growth, the city's contribution continues to play a vital stabilizing role. Let's now look at how these revenues, recoveries, and expenditures add up and what that means for the city's share. Here is how it all comes together. Our gross expenditure is $88.5 million after $2.7 million in recoveries and $53.7 million in revenues. The remaining $32.1 million is the city's net contribution. That is a 4.3% increase, about $1.3 million more than 2025. Now that we have seen how the numbers balance, let's turn to what they actually deliver. The programs, the services, and the community outcomes made possible through this budget. In other words, what this budget truly means for the people of Ottawa. It's nearly impossible to capture the full extent of how this budget supports all the work Ottawa Public Health will deliver next year. What you see here is a snapshot, a few examples of how this budget translates into real impact for our community. First, it allows us to expand our reach. We have recently opened a new dental clinic in Orleans, and the 2026 budget ensures we can operate it without seeking additional funding, increasing access to oral health services in one of the city's fastest growing neighborhoods. We have also created a branch dedicated to Indigenous health rights and reconciliation. This budget supports our aspiration to advance Indigenous public health through a culturally safer approach. Second, this budget enables digital and operational enhancements. We are expanding our electronic medical record system to strengthen coordination and quality of care. And by ensuring consistent base funding for 10 neighborhood community wellness hubs, we are making sure residents can access multiple services in one place, meeting people where they are and reducing barriers to care. Finally, this budget maintains all of our core public health services. We will share a few examples here. In 2026, this budget will support immunization programs that save young lives by administering more than 66,000 doses of vaccines to children and youth, protecting them from infectious diseases such as meningitis, measles, and HPV-related cancers. This budget will bring smiles to children, adults, and seniors by protecting oral health through screening over 35,000 school children and providing dental care to about 7,000 residents, including 3,000 seniors. It will support larvicide treatment for approximately 100,000 catch basins across Ottawa, and thus protect our residents from West Nile virus and other mosquito-borne diseases. It will enable OPH team investigating and managing an average of 7,000 infectious disease cases, and thus protect our community from a long list of infectious diseases. This budget will enable our public health inspection team to ensure food safety at more than 5,500 food premises across Ottawa, safeguarding our community from foodborne illnesses caused by highly infectious pathogens like Salmonella, E. coli. And finally, our budget will support 8,000 home visits to families through through the Healthy Babies, Healthy Children program, helping parents give their babies and children a healthy start in life. These are not just numbers. They are tangible examples of how public health reaches every neighborhood, every school, and every stage of life. In essence, this is what the budget makes possible. The essential public health programs and services that protect our residents, safeguard our city, and give children the healthiest possible start in life. But sustaining this level of services year after year requires more than efficiency and commitment. It requires a funding model that keeps pace with real costs. And that brings us to the long-term challenge that continues to shape Ottawa Public Health's financial reality, our structural funding gap. Our structural funding gap stems from two main issues. First, the province's commitment to fund 75% of cost-shared program budgets has not materialized in practice. Second, annual provincial increases of roughly 1% to base funding simply don't keep pace with a 3 to 4% growth in operating cost each year, a difference that widens over time. Together, these two factors create a structural funding gap that compounds year after year. And that growing gap illustrated on the next slide. This slide shows how the provincial funding gap has continued to widen for Ottawa Public Health's cost-shared mandatory programs. The blue bars represent OPH's total operating costs for these programs, while the orange bars show the Ministry of Health's contribution. The gray line tracks the provincial share of funding as a percentage of the total cost-shared program budget. As you can see, in 2023, the ministry covered about 62% of these costs. By 2026, that share is projected to decline to 56%, despite steady increases in operating costs. This widening gap isn't the result of new programs or expanded services. It reflects the growing cost of simply maintaining the same provincially mandated programs without corresponding increases in provincial funding. Let's now turn to the next slide, the actions and recommendations needed to make public health funding more stable, predictable, and fair. Here are the recommendations before the board tonight. We are recommending the board to receive and table OPH's 2026 operating budget and direct the staff to forward it to City Council for tabling on November 12th. We are also recommending the board to request the Province of Ontario to provide $450,000 in one-time in-year funding to help offset 2026 budget pressures. We are also recommending the board to request the Province of Ontario to implement the public health funding formula review as promised to us, along with annual base increases of 3 to 4%. So funding finally keeps pace with real costs. We are also recommending the board to approve the 2026 budget at its meeting on December 1st, direct the staff to submit the budget to City Council for final approval, and direct the Medical Officer of Health to submit the annual service plan and budget to the ministry. We'd be happy to take any questions. However, the board members can send out their inquiries to Casey. The residents can comment on the budget using the email healthbudget@ottawa.ca. There will be opportunities for public feedback throughout the month of November. with further participation in a discussion at the next Board of Health meeting on December 1st. Now, before I end tonight's presentation, I would like to leave you with a reflection, not about numbers, but about what they represent to Team OPH and our partners. This budget is more than a spreadsheet. Behind every dollar, there is a person, there is a story, there is a program, and there is a purpose. It reflects how deeply Team OPH values health, equity, and resilience. It is built with discipline, compassion, and purpose, balancing limited resources with unlimited commitment. It may be built on numbers, but it stands on trust. Trust that our partners will carry their share as we carry ours. To our partners, our board members, and our Team OPH, thank you for your trust, your leadership, and your collective effort in keeping Ottawa healthy, strong, and livable. But thank you alone does not feel enough. So instead, I will close with a few lines from a poem that I wrote earlier this year for our incredible OPH team. To our OPH team, let your heart know what eyes might miss. You are the root of health and bliss. So love yourself. Hold your head high. You are the reason health walks by. Silent yet strong in all you do. I see you, my friend. Ottawa sees you. Miigwech.
Thank you so much, Kibriya, for sharing that with us and for, of course, all of your tremendously hard work on the budget, you and your team. We will open it up to questions from members. If there are any. Member Grunwald.
Hi there. I just want to say thank you for the fantastic presentation. I can appreciate how many weeks and months, if not more, of work this represented for you and your team. It was a really clear presentation, especially for someone new around the board table. I have a quick question about the reference to the electronic medical record, and I'm just curious what types of services are captured and tracked in the EMR and how it is integrated or connected to the EMRs at some of our major hospital institutions around town. So whether it's the Queensway or CHO or TOH or Mall 4, is there connectivity so that we understand how the services that are delivered in the community are captured for those who might be visiting an ED or otherwise?
Yeah, I'll answer quickly that the electronic systems that we use are varied in public health, and we're talking a little bit about that later at the risk report. But we are not connected to any of the major hospital-based systems. Formally as a user, there's some access for viewing purposes only. That's not a cost to us, but for some of our infectious disease follow-up. But yeah, we are in the position of developing our own approach to electronic records, and in terms of how that's reflected in the numbers here, maybe Kibriya could add about what specifically the numbers here are reflecting. But we are advancing with a EMR system in some of our programs called TELUS, a collaborative health record. So that would be the primary one that we are investing in for documentation for clinical type encounters, but we have another number of provincial systems that we maintain as well.
Thank you.
Thank you very much. Vice Chair.
Thank you, Chair. I echo Member Grunwald's words around excellent work to get us to this stage. And I know it didn't just start this year. You have been focused on budget in the years leading up to this as well. It's always a tough sell. My question is around the assumptions that, so I fully support that OPH should receive our fair share from the ministry and the 75%, which is their funding formula that they refer to. Our budget is based on the fact that they come through with that funding though. And so just wanting your thoughts on, because that's not, we can advocate and I know Chair Kitts will do a great job on our behalf. It's not within our control though. And so what is our plan B should that funding not come through?
Thank you for the question. For 2026, our budget is based on an assumption that province will give us $450,000 additional dollar, not necessarily 75% of the total cost shared budget. Historically, the city of Ottawa has been filling the gap. So right now for 2025, the province is giving us 58% of the cost shared budget. And in 2026, this is going to go down to 56%. What we are calling actually for the province to implement funding formula review, it will enable the city to balance so that city doesn't cover more than 25%. It doesn't solve our problem entirely because we have, as I indicated, we have a structural funding imbalance, which means every year we need, on average, let's say $3 million additional revenue to support cost of living adjustment to our employees, wages and benefits. But the province only commit 1% growth. The city's current formula for tax levy for public health is not enough to support the entire amount that we need. And then these are structural. These are not easy solutions. So what we are planning to work with our financial service unit at the city. I had the conversation already. Next year, we want to develop a 10-year long-range financial stability plan. We want to bring different options to this board to discuss so that we get a commitment, at least from the city, to cover the annual recurrent cost, that is cost of living adjustment. We also can use this long-range financial plan as a tool to advocate with the province to fund their share. I hope I answered your question. Thank you.
Thank you very much, Vice Chair. I'm not seeing any other questions. So again, just thank you, Kibria, to you and your team for all the hard work. As you beautifully shared, I know it's more than just a spreadsheet to you, but certainly we know that year after year, you're dealing with an increasing challenge putting together the budget. And so we very much appreciate the clarity that you presented to us today. So thank you very much. Is this item received? Thank you. On to item 7.4, renewal of Ottawa Public Health's approach to supporting older adults in Ottawa to age well. And we have a presentation on this item as well.
Earlier this year, we undertook a review of our current programs and services to identify strengths, gaps, and opportunities for improvement to continue to support older adults to age well in Ottawa. Thanks for the opportunity to highlight our work with older adults and to share our future plans. My name's Erin Saluski. I'm the Program Manager of Chronic Disease Injury Prevention and System Integration, and I'm joined here by Kelly Biggs, an epidemiologist with us. And while I'm presenting this information tonight, this represents the work of so many teams and colleagues across OPH. The figure before you shows that Ottawa's older adult population, those aged 65 and older, is growing rapidly and will continue to do so over the next decade. The steepest increase is expected between 2024 and 2030, particularly between 2027 and 2028, when we'll see an increase of almost 8,000 in the number of older adults, the largest year-over-year increase in this group. Overall, between 2025 and 2030, the number of older adults in Ottawa will grow by roughly 40,000 people, representing a 19% increase, which is higher than any other age group. By 2025, or I guess by now, there are more older adults than children under 15. And by 2031, older adults will make up about 1/5 of the city's total population. Growth is even more dramatic in rural areas where the older adult population is increasing and will rise by 183% between 2011 and 2031. While this growth reflects people living longer and staying engaged in their communities, it also brings significant challenges for the health system, housing, and social supports. Some older adults face challenges such as low income, social isolation, and systemic inequities, which can lead to poor health outcomes and reduced quality of life. This demographic shift underscores the need for collaboration across sectors, targeted policy development to ensure Ottawa's older adults can age healthfully and safely at home and within their communities. OPH is mandated under the Ontario Public Health Standards to deliver specific programs and services across the lifespan. Our renewed strategy will continue to ensure compliance with the OPHS while enhancing and building upon existing programming and supporting initiatives of community partners. In place of me highlighting these initiatives, we've created a video that will provide an overview of some of the key programs and services that OPH provides in the community. I'll ask Casey to share the video. Thank you.
All of us. Over the next 5 years, we'll see nearly a 19% increase, or 40,000 more people. With growth comes opportunity to make it easier for older adults to stay healthy, safe, and connected. Aging looks different for everyone. Many older adults live independently, work, and volunteer. Others face barriers, like living alone or having limited income, that can make it harder to access care and needed community supports. Ottawa Public Health is working towards bringing services closer to where people are, reducing barriers, and supporting healthy aging.
أنا بتمنى هيك برامج. أنا تعرفت على هذا البرنامج عن طريق المسجد.
Falls are a leading cause of injury for older adults. Ottawa Public Health provides evidence-based fall prevention programs, including group exercise classes that build strength and balance and bring information and resources to older adults in aging in place buildings and other community settings.
I know that especially last time, I was using the chair a lot because I thought my balance was good, but found that I couldn't do some of the things. At the beginning, at the end of the session, I was hardly using the chair at all.
I've seen a big difference in the members participating in this program. After 2-3 weeks, they were feeling stronger, more confident in themselves.
Through neighborhood health and wellness hubs, the community engagement team and the chronic disease prevention team work with community organizations to connect older adults to prevention services, information, and navigation support in trusted, familiar spaces.
The African Caribbean and Black Wellness Resource Center opened our doors in 2021, and we had maybe about 5 seniors that were participating in our programs, and it has grown to over 50.
I've been coming here for the last 3 years. To be honest with you, it's like a family renewal. I meet the same people every Wednesday, and they just put so much life into me that I really, really enjoyed it.
C'est briser l'isolement. Ça, c'est très important. Je les vois rire ici, je les vois faire des blagues, donc c'est très bien pour leur santé mentale. OK? Ça les permet de sortir de leur logement.
Ottawa Public Health collaborates with community health system partners and community groups to offer screening and connect people to follow-up care. Early detection and clear next steps make prevention possible.
A lady who had come to this program and was found that she had severe aortic stenosis and required a new aortic valve. And so they were able to do a procedure called TAVI to replace the valve for her. And she had said that after having the procedure, she noticed how much better her quality of life was. So where she had been short of breath before, when she would go upstairs or doing her groceries, or she was tired very easily, she didn't feel that way anymore and she felt good.
Oral health matters. In Ottawa, while some older adults may qualify for federal dental coverage through the Canadian Dental Care Plan or for provincial coverage under the Ontario Seniors Dental Care Program, cost remains a barrier. Ottawa Public Health's dental outreach provides fluoride applications, referrals, and system navigation for these programs because coverage and affordability strongly influence access. In 2023, approximately 60% of older adults screened needed follow-up care. In long-term care and retirement homes, Ottawa Public Health provides evidence-based guidance, training resources, and outbreak support to implement best practices in infection prevention and control. In the last season alone, Ottawa Public Health supported over 190 respiratory or enteric outbreaks, helping protect residents and staff. OPH improves immunization access through community and pop-up clinics, and by sharing clear information about flu, COVID-19, and RSV for higher-risk older adults. Together, through strong partnerships and a shared commitment to prevention, equity, and impact, we are building an Ottawa where aging is celebrated and supported.
And back to the presentation just for a few more slides. So through our review, we highlighted key areas of focus, including working towards creating an age-friendly community, preventing ageism, and the need for better system navigation to connect older adults to needed information, programs, and services. The outcome of our review aligned very closely with the focus of the city's older adult plan, which, as you know, is a comprehensive municipal strategy aimed at making Ottawa an age-friendly community. This plan has so far been approved by the Community Services Committee and will be heard by Council for full approval next week. Aligning our efforts ensures that our work is integrated into broader municipal services to maximize impact and resource efficiency. And through this alignment, we can amplify our existing work, reduce duplication, and strengthen collective efforts with city and community partners to support older adults. And finally, in addition to our regular work, like providing immunizations, dental services, and infection prevention and control, we will be focusing on some new initiatives. We will contribute leadership and public health expertise in the implementation of the Older Adult Plan through participating in the city-led task teams and the Older Adult Plan Roundtable. We will collaborate with CSSD and community partners to co-design a dashboard to centralize and share key data to inform system planning, identify gaps, and inform decision-making. And we will continue to grow and expand the services provided in the neighborhood health and wellness hubs, including in more rural locations. For immunization, existing vaccination clinics will continue, including for high-risk older adults in retirement homes and those without primary care. We will also provide RSV vaccinations for those 75 and older. This is an expansion and new this year, as they are not yet available through the pharmacy at this time. And finally, our environmental health team will work on a few projects to address impacts of extreme heat on older adults. Thank you.
Wonderful. Thank you so much for the presentation and for sharing that video with us. We do have 2 delegations, so we will now go to them and then return to questions for staff. So our first delegation is Cynthia Paget. I believe she's joining us online.
Can you hear me?
Yeah.
Thank you. Sorry, but I realized that my camera is not the one I'm using usually. Thank you so much for having us here today. I am joined here today in attendance by Lisa Lafontaine, who's the lead staff overseeing the development and implementation of the city's older adult plan. I'm really pleased to be speaking tonight in support of OPH renewed older adult strategy. OPH and CSSD have a long history of working together, and this report and the alignment with the city older adult plan really strengthen that partnership. This renewal is closely tied to the City Ottawa older adult plan 2025-2030, which is set to go to council for approval on November 12th. This is a great example of how we can integrate public health initiatives with broader city efforts, creating a coordinated, evidence-based approach that supports the health, safety, and well-being of older adults. The Older Adult Plan is Ottawa's strategic response to the growing older adult population. It was first introduced in 2012, and this new version marks the 4th update. It reaffirms our commitment to making Ottawa a city where older adults can truly age well. By 2031, as we've heard in the previous presentation, we can expect almost 20% of Ottawa's population to be 65 or older. That is a significant shift, and it brings both challenges and opportunities when it comes to planning, service delivery, and community engagement. This renewed plan is designed to meet the evolving needs of Ottawa's diverse older adult population. It was shaped through extensive public consultation with over 1,300 residents and community partners contributed. The model we're using draws on best practices from other municipalities and aligns with both the World Health Organization's Age-Friendly Cities Framework and the province Age-Friendly Community Planning Guide. One of the key features of the plan is its collective impact approach. That means we're bringing together people from different sectors to work toward a shared vision with clear, measurable outcome. The plan was developed in collaboration with 11 community agencies, each bringing their own expertise and lived experience to the table. Together, we created a shared vision, mission, and guiding principle to guide both the development and implementation of the OAP. The vision is a supportive community where everyone can age with choice and dignity. And that together we work to advance the well-being of older adults through equitable and inclusive access to programs, services, and information. While the full scope of actions will be developed collaboratively, we're already moving forward with some initial steps. One of those is the creation of the OAP Roundtable, which OPH will be a part of, providing leadership and public health expertise to support planning and implementation. As mentioned earlier, we're also working on an older adult data dashboard, which will be led by OPH and co-designed with CSSD and our community partners. So again, we wanted to be here today to reiterate our support for the older adult strategy. Thank you for the opportunity to speak today, and I'm looking forward to the continued collaboration and the positive impact this plan will have on our community.
Thank you very much, Cynthia. I'm not seeing any questions for you, but thank you for being here this evening. Our next delegate is Dr. John Joannis, also online.
Good evening. a lot of what I have to say has already been said. So that means I have to invent things. Bonsoir à tous. Merci d'avoir invité le Conseil sur le vieillissement à votre réunion. Moi, je suis un médecin de famille qui a surtout fait de la gériatrie en fin de carrière. Et j'ai travaillé dans pas mal tous les secteurs. Et je suis maintenant bénévole au niveau du Conseil sur le vieillissement et je co-préside le comité de santé. First of all, you'll be relieved, and I'm relieved that I'm not here to ask for more money. After listening to the budget, I don't think that's something that I would want to bring forward. So we are here in support, obviously, of the renewed adult older strategy, the older adult strategy, which is really quite important. The renewal, as mentioned, this is like the fourth version, and it seems to be getting progressively better. The initiative is timely and it's essential. Without going back into the demographics, they're quite obvious. We're getting more and more folks who are aging. Just one of the things that I do is I teach successful aging at the Faculty of Medicine. We go through all the demographics and all of the stuff that is important for successful aging. And one of the key things that we talk about is actually what we're discussing tonight, which is the environment. So not people's illnesses, but rather what they are in, what is there for them. So at the Council on Aging, we contribute to the work. First of all, we lead the Age-Friendly Ottawa initiative, which engages older adults in identifying barriers and solutions across critical areas such as health, housing, transportation, income security, and Francophone affairs. The grassroots input, and we have our ears to the ground, I like saying, because we're advocates. We can't promise anything, but we'll promise we'll listen. The second thing is through our Health Issues Committee, so the committee that I co-preside, we advocate, and this is the key word, is advocate. We can't do much other than advocate, but advocating is really important. So we advocate for improved access to health care, including primary care, which is of course in the news, mental health services, home and community care, and falls prevention. We collaborate closely with the Ottawa Public Health on initiatives that address social isolation and promote healthy aging, including the expansion, obviously, of older adult services in the neighborhood health and wellness hubs, which were mentioned earlier. We certainly value OPH's active participation on our committee, and we have regular meetings with the OPH, most recently with Aaron last week. Thirdly, we deliver smart aging programs. So this helps older adults prepare for late life transitions through workshops and webinars. We cover topics such as fall prevention, emergency preparedness, nutrition, navigating the health services. Somebody brought up the question of informatics, and certainly we try and help our older folks beware of scamming and phishing. You know, phishing in the elderly used to be something that you did after retirement, but right now it seems to have changed meanings. We're proud to partner with OPH's Health and Wellness Hubs to deliver this program in the community. And to further strengthen the implementation of this renewed approach, we respectfully offer 3 recommendations. So the first one is to strengthen the data collection and evaluation partnerships. So to ensure the plan remains responsive and evidence-based, we recommend that Ottawa Public Health collaborate with community organizations like ours to collect meaningful data and share insights. This will help track progress and adapt to emerging needs. Just an aside, within the structure of the Council on Aging, there is another committee that looks at housing and community needs, and the Health Issues Committee and this other committee sit on each other's meetings. So they're very closely linked. And I think that emphasizes the importance of the non-medical part of health. And that's coming from a doctor. It's really, really critical, and the COA puts a lot of emphasis on that.
I hate to interrupt you, but you are at time. So I'll just see if there are any questions for you.
Okay.
I'm not seeing any hands up. Oh, my apologies. Member King.
Thank you so much. And I was just curious about the two other points. So if you could elaborate on those, or maybe just briefly outline them, would be much appreciated.
So the other point is to support inclusive health communication. So that has already been talked about with the diverse population, the health messaging, and access for minorities, Indigenous adults. And the second is we want to link closely with others with the older adult plan. And so we're suggesting that there be membership bilaterally in both directions between Ontario Public Health or the Ottawa Public Health and our committee, and even look for representation perhaps on the board. So I will send a document on that will specify this a little bit more clearly.
Appreciate that. Thank you, Chair, for the indulgence.
Thank you.
Thank you very much, Member King. I'm not seeing any other questions. Mais merci beaucoup pour votre délégation, Dr. Johannes.
Bienvenue.
Thank you for being here. Okay, so we will open it up to questions to staff if there are any from members. Member King.
Thank you, Chair. And I really just wanted to really emphasize my appreciation for the strategic alignment between OPH and the city's older adult plan. At committee, we saw the plan approved, and it does represent a transformative evolution in how Ottawa supports our older adult community. And it's one that recognizes both the tremendous contributions of seniors to our city and the responsibility we have to ensure that they can age with dignity and choice. I think what's special about this plan is that when we compare it to the predecessor plan, this plan is different since it adopts a collective impact model. And I'm really pleased to have seen that in action in terms of the video with the African Caribbean Black Wellness Resource Center, which is proudly in my ward. I think I actually was on site when the video was being made. So it really does speak to the fact that OPH is working hand in hand with partners. And I think it's very strategic that we see senior programs emerging in localities, in facilities that actually host neighborhood health and wellness hubs. So I think that speaks volumes. It's very important. Obviously, that video demonstrated a commitment, a strategic commitment to serving those who are most vulnerable, whether they're low income, racialized, Indigenous, or isolated people trying to break isolation, which is very important. I wanted to know how will OPH measure the success and impact of this renewed approach, and what the key performance indicators would be.
Thank you so much for that question. So yes, we will be seeking to measure the success of our overall strategy and approach. As we begin the work, we'll continue the work with CSSD, joining the roundtable and the task teams, identifying the work that will be underway. We will be able to identify our key performance indicators. And we really are seeking to measure the impact of our work overall, but more to come.
I appreciate that, because obviously we need to measure to determine whether we're making progress. I think it's also very important if we have a co-created approach that we obviously work with our partners, such as the Council on aging and other partners to determine what is working, what is successful. So I hope that that is part and parcel of the approach that we take. The one last, I suppose, unrelated question was just about the stunning statistics around the growth of older adults in rural areas. I'm just wondering what specific service delivery models are planned for rural areas, and will there be barriers due to geographic distance?
Yeah, so what we're planning to do in rural areas is expand the approach that we've taken in neighborhood health and wellness hubs with the enhanced services for older adults. We've been talking to partners in the areas to identify opportunities. To provide a few examples, this fall we worked with Melanoma Canada to provide it was skin cancer screening, the Mole Mobile. And we identified some city locations, but also a rural location as well. It was in the video as well, but we're working with the Heart Institute to provide heart valve screening checks. And they're interested in continuing this work into 2026 and looking at rural locations. We're, kind of a little bit different than the approach with our other neighborhood health and wellness hubs. We don't necessarily see having like a static location in rural neighborhoods, but rather working with the partners and organizations that are there to identify locations that will make sense, and working with the community and support. The CSS sector to support with transportation, so that we can have a bit of a broader reach and make sure no one is left behind who wants to participate.
Well, I appreciate that work, and I appreciate the work just generally overall. I think it really demonstrates the collaborative, inclusive approach in order to improve the quality of life of older adults in our city. So I really just want to thank you for the report, thank you for the work, and thank you for the collaboration with multiple partners on the city's plan. Thank you, Chair.
Thank you for your questions, Member King. Member Chung.
Great to see. So thank you for this report. I just had two questions. One question is, had there been any consultations with groups advocating or representing, adults or with neurodevelopmental disabilities? I'm just thinking of, Down syndrome. There's people living with Down syndrome. They're living longer now. And just kind of, looking at what their needs are, because their needs would be different from potentially other adults. And then the second question is, I just noticed that a lot of the initiatives are kind of based more on disease prevention as opposed to, say, health promotion. And have there been any consideration for, and I'm just, and this might be getting into the nitty-gritty, but say play structures, working with the recreation unit for like play structures or active living activities for older adults. I'm just thinking of like, say, in a lot of Asian countries like Hong Kong, in addition to play structures for children in the same area, there are, just ellipticals or I don't know, like bars that are, at height level, not so lowered for children, but for older adults, so they can do chin ups, things like that, and other types of structures that help to improve their balance and coordination, that kind of thing. And also, areas for, to play chess, that kind of thing, because we know that, older adults can be isolated. This would improve their mental well-being, their isolation, physical, like their cognitive ability, all that kind of rolled into one. So just wondering.
I'll start with the first question. So the consultations, we really leaned upon our colleagues in CSSD and the consultations that they had done as part of the older adult plan. In terms of, specific consultations with groups, like you mentioned, we have not done that work directly so far, but we can work with our colleagues in CSSD and otherwise to take a look at that. So maybe that's something that we can take away. Related to your second question, I think a lot of, and the examples that I provided certainly focused on a disease prevention angle, but we really have been using the neighborhood health and wellness hubs and the expanded services for health promotion related activities as well. Your ideas are interesting. I know RCFS, or they had been discussing trying to seek some funding for a play structure like you're speaking of. I don't know what happened with that, so I'll have to follow up and see. But in terms of strength and balance, that's one area that we do focus on, with falls being, one of the leading causes of hospitalization for older adults. We work with partners to provide strength and balance and falls prevention programming with community. We've also worked with Rogers to transform those into videos that people can access outside of our neighborhood health and wellness hubs, either through YouTube or on the Rogers channel. But working with our colleagues in RCFS, we can identify other opportunities to support older adults to be active and maintain strength and balance as we proceed through the strategy. So thank you for your questions.
I'll just add that under goal 2 of the strategic plan, we look at healthy supportive environments. And I know that Erin's team works with them through strategy and through other areas to come up with ways to look at health promotion, not as a one-on-one, but also indirectly through policies and the new Ontario Public Health Standards, which I mentioned at the beginning, are focusing more on this idea of comprehensive health promotion, which we have a lot of experience in public health, looking at taking ideas from other places and just as you've suggested around how can we impact the environment to make things healthier for older adults and all populations. Falls prevention is something where that's been looked at in the past as well. So we'll take those suggestions and it could form part of goal 2 as well in terms of healthy supportive environments. Thanks.
Great. Thank you very much. I'm not seeing any other hands, but appreciate the report and all of your work. So thanks for being here tonight.
Thank you.
Is this item carried? Great. Thanks, everyone. Item 7.5, risk management at Ottawa Public Health. We held this. Dr. Arson, I know you wanted to make a comment.
Good. Yeah, thanks very much. And I think, some of the discussions today have alluded to this subject as well. I think, as the medical officer of health, I thought it was important just to highlight that we have this risk report because it's a key component of Ottawa Public Health's accountability to the Board of Health and, of course, the Ministry of Health. But, there's a real expectation that boards of health are considering these risks and mitigation. So this report provides a transparent overview of the most significant risks facing OPH this year and outlines how we are actively mitigating those risks and trying to protect public health and maintain services for community of continuity for Ottawa residents. So we're highlighting, first of all, climate change continuing to be posing serious health risks, especially for equity denied groups. And OPH is advancing targeted adaptation projects, but progress has been limited by funding constraints and greater need for coordinated action with the City of Ottawa across sectors and all levels of government. The second one, we were talking a bit about technology earlier, and I mentioned that we at Ottawa Public Health are trying to modernize our digital infrastructure And we're doing that through initiatives like new collaborative health records system expansion and the ones we've been using for years that are provincial systems, updating them and trying to make adaptations locally. We've also been looking at our workflows, using AI-powered workflows to find efficiencies. And that was mentioned in the budget. But I think, what I said earlier was that, we lack a provincially coordinated digital strategy. And I think this board has heard this a number of times in different presentations, including for infectious disease health protection and inspections and so on. That really hinders us in a lot of ways when we're relying on legacy IT systems, and they could also potentially have vulnerabilities or security risks, but more importantly, they really limit our efficiencies and our ability to do work as quickly and effectively as possible. The other risk that we're highlighting is, as we heard earlier, the growing complexity in community health needs, but and the population growth combined with a lack of growth in provincial funding. It's straining OPH's ability to meet the standards and respond to emerging issues. We saw the relative sort of flatlining of the increases in provincial funding to address the growing population, and there's quite a large growth in population and complexity. And without adequate investment, our capacity to deliver preventive services and respond to emergencies are an increasing risk. And so as we look ahead, we remain committed to managing these risks proactively and strategic collaboration to protect the health of Ottawa residents. And we endeavor to provide the risk considerations for all our reports that are coming. There's sections in the reports that come to the board around risks, so we'll continue reporting on those. We're going to continue to request and ensure we have the resources and partnerships needed to address these challenges going forward. So I just wanted to highlight that report. Thanks.
Thank you very much for providing that added color. Member Bauer.
Thanks, Chair. I've got a question on one of the specific risks identified and then a more general comment. On the digital transformation risk, and Dr. Arneson, you raised this, it is concerning that in the absence of a provincial digital platform, we're relying upon legacy systems, and especially with the advent of emerging technologies, artificial intelligence, the security and privacy risks increase as we use those tools or implement them. So I wasn't clear perhaps what security and privacy frameworks are we using to guide our digital transformation? Are we using the city, or is there a provincial one that we're using? It just becomes more and more critical as these technologies are implemented.
So I'll ask Cameron Keys if he could maybe provide a bit more insight, but then the main substance of the answer is city frameworks is what we use. But Cameron, if you could provide a bit more clarity.
Yeah, thanks for that question. Yeah, absolutely. We are on the city systems, and so any system on the city follows all of their cybersecurity policies, procedures, processes. We have our own as well, but yeah, for the most part, we follow the city, and provincially, we also follow provincial legislation like PHIPAA, like the Personal Health Information Protection Act of, I think, 2004. We follow that as well. So yeah, there's a lot of processes. Why this is such a high risk to us is, on top of having good processes in place good procedures, good training. We want to make sure that our systems also provide really good things like auditing and logging and retention and all these things as well. And because some of our systems are legacy, we could do better in that respect. So we're doing everything we can, but we just need to migrate to and modernize in order to ensure that that we're even more secure.
Yeah, and I'm getting some information here that, I mean, the provincial piece actually maybe is quite important as well. I mean, the legislation is provincial, and that guides a lot of our requirements, and I don't want to make it seem like the city infrastructure is a big concern from the risk perspective. I mean, we're living in an age where, Amazon and Google seem to be having cybersecurity risks, so nothing's perfect. But I think the issues that we're grappling with on a regular basis, and we've talked about even just today, is not sort of this idea that people are going to come from the outside and steal information. That's, the city has a very good framework and plan around these cybersecurity risks and managing them. I think it's more around the privacy and confidentiality standards that are expected of healthcare organizations when you're looking at personal health information and how it's managed internally and how it's shared across teams. And that's where it relates to what I was talking about, efficiency and effectiveness, right? We don't have the same systems you might have in a hospital or healthcare center where we can easily transmit information. We're using sort of different teams on different provincial reporting systems that are not necessarily made for documentation and sharing, information as it relates to a measles case or measles response, those types of things.
Great, thank you for that. My second question is around, and perhaps I missed this in the meeting materials, but last year we were provided with sort of the overall risk management dashboard, color-coded. There are 5 in the red. I think this report highlights 3. Just wondering if, I think there were 12 risks overall that were identified. I just didn't see that sort of overall portrait, and if that would be available to the board.
Yeah, again, Cameron can talk about the approach his team is taking with the risk management oversight, which is it is an all the time thing, and how we're presenting it to the board, how it's coming forward to the board.
Thank you again for the question. So yeah, last year we revamped a lot of our risk management processes. And so we even had a board retreat on risk. And historically speaking, what we bring to the board every November as part of ministry reporting are those risks that the ministry asks us, tell us your top risks, so your highest risks. And so before we send that information to the ministry, we want you to see it first. But what you're talking about is something really important as well. Like, let's see all of the risks, not just those labeled the most serious. And so definitely that is something. Last year we had 12. This year we have 10, mostly because we're just consolidating. We're just becoming a little bit more just better at risk statements. So I think that moving from 12 to 10, more or less, we're seeing the same things. There really hasn't been anything too new that has popped up. Legacy systems, there's now 2 IT-related risks instead of 1 because we really wanted to tease out legacy systems. But the rest have just been word changing, but happy to provide both last year's risk registry and this year's risk registry and provide that to the board.
That would be very much appreciated. I just noticed, for example, that there was one last year on mental health, substance use in housing. So obviously, an ongoing, very high risk in terms of what we've been discussing over the past year. Thank you.
Great. Thank you very much for those questions, Member Bauer. I'm not seeing any other hands. So is this item carried? Great. Thank you, everyone. So that brings us to, we have no in-camera items. Motion to adopt reports. Member Chung, please.
The chair of the Board of Health verbal report, the medical officer of health verbal report, and the reports titled Renewal of Ottawa Public Health's Approach to Supporting Older Adults in Ottawa to Age Well, Risk Management at Ottawa Public Health, and Attendance at the Association of Local Public Health Agencies Fall Symposium be received and adopted, and be it further resolved that the report titled 2026 Draft Operating Budget for the Ottawa Board of Health be tabled for consideration at the Board of Health meeting of 1 December 2025.
Thank you. Is this carried? Thank you. We have no motions of which notice has been previously given and no motions requiring suspension of the rules. Are there any notices of motion? Seeing none, confirmation bylaw, Member Chung.
Bylaw number 2025-7, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of November 3rd, 2025 be read and passed.
It's carried. Thank you. We don't believe we have any inquiries this evening. So we are adjourned. Next meeting is Monday, December 1st. Thank you, everyone, for joining us. Have a great evening.